Hello, my name is Verdier. Today I will be presenting our approach to patient positioning, fluoroscopy and draping for proximal humerus fracture surgery. Proper patient positioning is critical for successful fracture surgery. Obviously, fluoroscopy is necessary, as is a complete review of your checklist before surgery. Here you can see some examples of proximal humerus fractures. And here, some treatment of proximal humerus fracture. Many can be treated non-operatively. However, some require surgical management, which may include humerus intramedullary nail, proximal humerus plating, hemiarthroplasty with fracture stem, and reverse shoulder arthroplasty using fracture stem. As previously noted, patient positioning is critical for surgical success. In this, for arthroplasty and for fixation of proximal humerus fractures by open surgery, we place the patient in a lazy bed chair position. This position has many advantages. Positioning the head nearer to the level of the body is better for hypotension control and reduce risk of cerebral hypoperfusion. The free arm with the shoulder off the table allows for dynamic control of arm position intraoperatively. This position is also well tolerated by the patient. Here you can see the operating table and the required support, including the antidecubitus cushion necessary for safe and effective patient positioning. This video shows how step for sterile patient prep and draping for shoulder arthroplasty fractures and open shoulder nailing. Once general anesthesia is induced, the assistant nurse, the resident, and the surgeon position the patient. The supports and antidecubitus cushion are positioned for patient comfort and safety, ensuring that the patient does not slide or fall during half movement and tilting of the bed during surgery. The sterile skin prep is done with a combination of betadine and alcohol and includes the hand and forearm. Then we begin draping, and gloves are changed after the first layer. Two tables are required for the instrumentation. One of the two tables is positioned over the patient and one behind the nurse, opposite the surgeon. Finally, the nurse faces the surgeon. Following draping, the skin is marked for the surgery and new band is applied. Finally, the forearm is draped in the stockinette and sterile wrap. For percutaneous shoulder nailing, the patient is placed in a lateral position. What are the benefits of this position? It facilitates the surgeon movements and allows for safe anesthesia. It optimizes the surgeon's mobility due to the lack of few drapes or spider. This is beneficial for both the surgeon and the X-ray technologist. The surgeon has full access proximally and posteriorly on the patient's shoulder. This position maximizes degrees of freedom for fluoroscopy and allows us to obtain true anterior, posterior, and lateral shoulder views. Here is the final position of the patient viewed from posterior and an anterior view. You can see the soft fixation of the head, the axillary roll, and finally the sacrum support. Also, we place a pillow between the legs for patient comfort and the pubic and thoracic support for patient stabilization. Here is a video example of a patient sterile prep and draping for percutaneous shoulder nail. You can see the resident, the surgeon, and in front of the surgeon, the nurse. Thank you for your attention.